Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 17 minutes past 8 o'clock. It's Monday morning, the 9th day of February 2026. Good morning, everyone. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. In Durango, Colorado, our frequency there is 103.3 FM. And if you're listening to us anywhere else on the planet, you've gone to our website to tune in, streaming all the time, of course, from ksje.com, or maybe you're listening through the new KSJE radio app. It's great to have you all with us this morning. Also want to welcome our viewers who are joining us. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. Coming up this morning, we are talking with guests from Presbyterian Medical Services. They're going to be here telling about some of the services they provided to the community and much, much more. That is coming up in the next few moments right here on KSJE this morning. And then later on this hour, as we do on Mondays, our Monday Reboot segment at 8:50 a.m. We'll be talking technology with my guest, Lewis Campbell from Synergy Computer Systems here in Farmington. Next hour, of course, Roving with the Arts, our weekday classical music program. Mick Hess will take over the studio at 9:06 here on KSJE. A reminder, you can also connect with us on other forms of social media if that's your thing. Check us out on Instagram, on Blue Sky and X, in addition to Facebook and YouTube. And you can also download KSJE podcasts to stay connected on the go. They're available where you're already listening to podcasts, or even better yet, they're also available with the new KSJE radio app, available at the App Store and on Google Play. Outside our studios here at San Juan College right now, 27 degrees outside. It is going to be a sunny day today with a high near 60 degrees in Farmington. Can you believe it? For February, 30 overnight with clear skies. Tomorrow, sunny and even warmer, 62 for a high on Tuesday. Partly cloudy overnight with a low of 39. Then on Wednesday, maybe a chance of rain showers, 50% chance, high 58 on Wednesday. 38 overnight with more chances for rain or some snow overnight. Maybe clearing out a bit on Thursday with partly sunny skies, 59 for a high. Back with some rain showers overnight Thursday, back into Friday. Another 50% chance with a high of 48 on Friday. Cooler weather coming in, 36 for a low Friday night. And we'll keep an eye on that as well. I'll be back with my guests from Presbyterian Medical Services right after this on KSJE. KSJE is supported by San Juan Regional Medical Center, your community hospital serving the Four Corners. With a 115-year history of improving the quality of life, health, and care of individuals and families throughout our region. When life happens, San Juan Regional Medical Center is here to serve everybody. Find out more at sanjuanregional.com. Ready to make a difference close to home? The University of Denver Graduate School of Social Work Four Quarters program is accepting applications for the 2026-2028 Master of Social Work cohort. Classes beat Fridays in Durango, letting you keep working. Learn more at du.edu/socialwork/fourcorners. Students can change the future with DU and apply now for lasting impact. My guest this morning, as I mentioned, from Presbyterian Medical Services, joining us here in the studio. Kristine Carlson is here from PMS. Kristine is the Regional Behavioral Health Clinical Manager. Good morning. Thank you for coming in this morning.
Good morning. Thank you for having us.
You bet. Good to have you here. Also with us this morning, Andrew Caldwell is here. He is the administrator of the Farmington Community Health Center. Andrew, good morning to you.
Good morning.
Good to have you here as well. Thank you both for coming in. And a reminder to our listeners and viewers this morning that I remain a proud board member of Presbyterian Medical Service, so just full disclosure for our audiences this morning. But to get us started, we want to talk a little bit about some of the things that PMS offers at the Farmington Community Health Center and in the community. And so, Andrew, let me start with you a little bit about all the things that the Community Health Center offers and some of the other things that we want to talk about this morning as well.
Sure. So as most people know that we do medical, behavioral health, dental, psych services, and we have a pharmacy on site.
Right.
But this morning I really wanted to let people know some of the other services that you may or may not know about.
Sure.
One of the exciting things that we started through a grant, and the grant expired, but we continued the service, was a service with our pediatric program. So it's really hard to get referrals and follow up with referrals in rural New Mexico. So one of the things that we recognized is it would be helpful to have a case manager help families navigate through some of the more difficult referrals. So
right.
We actually have a staff member, Talea Claw, that helps with referrals that families receive through our pediatrician, Dr. Pomo, and helps them navigate some of those more difficult situations, whether that's with following up with the referral or arranging for transportation to get to Denver, Albuquerque, some of the places that you might have to go.
Right.
And so it's an added service that we're able to do. We're really happy to do it. But it's one of those things that a lot of times people don't realize some of the challenges that we have accessing quality health care in rural places.
Sure. Well, and that's
because of a lack of specialists.
Right. I guess that was going to be my next question, that's usually specialized care too, right?
Correct.
Those referrals. And
Correct.
So sometimes you have to go to a larger place to take advantage of those things. And that's kind of what you're talking about. So this employee of PMS can help families kind of figure that out, and maybe the best ways to do that or some other resources to help them do that. Is that kind of what she does?
That is correct. And it's just a service we offer. There's it's not going to hit your insurance or anything. That's just what we do.
It's another free service, I guess, or additional service.
Additional service.
Yeah, got you. And that's great. And I know, I think for a lot of families, getting a pediatrician is an important thing, to find one that will accept patients and things like that. And that is the case at the health center as well. Dr. Pomo is accepting patients and working with them.
Dr. Pomo is accepting patients. We're currently in the process of recruiting another pediatrician. So hopefully by summer we'll have another face,
nice.
Another friendly face there to help see some of the kiddos.
Very good. I know recruitment is another issue all around our state, all around our country, I think, to find doctors and healthcare providers that want to come and work in rural areas and not so rural areas. And so it's great that you have providers that are seeing patients, and folks can, I think, walk in. You always set aside some time, at least you used to, for walk-ins at the health center?
Yes, sir. We do have walk-ins every day.
Nice. So. Who you're able to see or try to accommodate.
Yes.
Yeah. So that's great. What else is going on that we want to cover this morning?
So one of the other things that are happening in the nation is a lot of talk about Medicaid. So
right.
I want to let people know that Medicaid's still there, and the requirements might be changing or preparing to change, but it's still really, really important for us to have that financial ability to pay for medical care. Mm-hmm. So I really encourage people to, if they're not on an insurance, to make sure that they're exploring their options. One of the things that PMS does is we have people that come every week to our site to help connect people to financial resources to help with medical costs. So we have an MCO that comes every Tuesday, and sometimes they're there twice a week to help people with navigate the Medicaid enrollment process. Be Well NM comes out on a regular basis. They help with Medicaid, Medicare, and the Be Well NM portal.
Right.
I want to remind people that it's my understanding, anyways, that New Mexico kept some of the assistance for the I guess Obamacare is what
The Affordable Care Act, right? And some of the subsidies, I guess, that were approved with that legislation. And so the state has come in to kind of try to fill in maybe some of the federal cuts?
To bridge some of those gaps.
Got it.
So it is...
but if folks have questions, you've got folks that can answer those, I guess.
Absolutely.
Okay.
So, and if we don't have anyone there that day from a specialized organization, we actually have a person that Monday through Thursday that helps navigate that process as well.
Nice.
And that's
right there, right there at the health center. Got it. So. And again, I think it's important to point out too that I think the health center and Presbyterian Medical Services accepts all forms of insurance, whatever someone has, if they have insurance.
That is
if they have Medicaid, Medicare, whatever. If they don't have anything, you'll take cash, but it's a sliding scale, I think, too, and all that.
And there's also local grants. We work with the county to help bridge some of those. There's also other financial assistance that the county does through HCAP. And so there's lots of resources out there. It's just connecting you to the right one and making sure that we have the information to help you navigate that.
Sure. You know. And it seems to me too that the company, the folks that work at the health center, and all the other PMS programs never want cost to be a barrier to getting health care or anything that you offer. That's kind of the mission of the company, it seems to me.
Yeah, cost should never be a barrier to being healthy, whether that's physical or mental health. That's everyone deserves to be healthy.
Right.
We want them to take care of everyone regardless of your ability to pay.
Sure. But you've got a lot of resources, I think, to help make sure that folks don't have to worry about that, I guess, when they're trying to get health care for them or their family.
That is correct.
Yeah, and so that's a really important part of this. So I appreciate you reminding us of that, and of course, and managing all of that as well, because it's an extra step, as you said. I don't think you have to do it. It's something that you just do because it's the right thing to do.
Yeah. We like doing it. That's why we're here.
Yeah, exactly. Very good. Well, I appreciate you coming in this morning, too, to talk a little bit about that. Kristine Carlson's here as well to talk about maybe the other side of this as well, which is behavioral health and some of the other things that the Farmington Community Health Center offers and some of the other things that the company offers in the area. So, Kristine, I'll turn it over to you a little bit about some of those things, because that's another important part of someone's overall health is their mental health as well.
Well, this is our second year now, starting our second year as a CCBHC, or Certified Community Behavioral Health Center.
Right.
Which is fabulous for us. It's enabled us to expand our behavioral health services. So we still offer the same services that we've always offered: therapy, group therapy, psychosocial rehab. We do some courts programs, change court and clear court. And psych services, all of those are still the same, but we've most recently, we've added our mobile crisis response team. So that is up and running 24 hours a day, 7 days a week now.
Talk to me a little bit about that. Pardon me for interrupting, but I wanted to ask you about that. And that acronym that you mentioned is a certain certification, correct? A certain level of care that you're able to provide. And so that doesn't come without a lot of hard work, I think, too, right?
Oh, is it? Yeah, a tremendous amount of work. Yeah. Yes, yeah.
And so this mobile unit, tell me a little bit about that. 24 hours a day, 7 days a week.
And so if someone calls, say, 988, or they're talking with a police officer, and it seems like what they really need is a behavioral health response, less than a legal response. Say they're suicidal. That's probably our most common call.
Right.
Or just having some things go on. We can send a therapist and a peer support specialist to their home or to wherever they happen to be in the community to meet with them, de-escalate, connect them, either back to services they're already engaged in or to new services as required.
Right.
And we also do some follow-up if, say, the police department is having an issue with someone that we don't go out on the call with, say they get hospitalized or something.
Sure.
We can do a follow-up contact after that to say, hey, are you doing okay? Do you need any assistance connecting to your behavioral health services? So I think it's something the community's needed for a long time. We're really excited to be able to provide it.
Yeah, definitely. And as you said, this is 24 hours a day. And so, because again, some people have a crisis outside 9 to 5. And so I guess this is how you can respond.
Yeah, absolutely. Absolutely.
And providing these services, again, you've got folks who are on call or ready to go?
We do. We have an incredible staff of people willing to be on call and
nice.
Up and ready in the middle of the night.
Right. And does this cover Farmington, San Juan County? What's the range? I mean, obviously you're limited to how quickly you can get to places and things like that, but I guess this is designed to cover a wide area?
It is. Currently we're covering primarily Farmington, Aztec, Bloomfield. Kirtland will eventually be able to cover the county. We're not quite there yet.
Okay.
Because our county, as you know, is just enormous.
Right. But still, that's still a lot of land to cover.
Working our way out.
Those places, for sure. And certainly this wouldn't be possible without cooperation from, like, the police department, the sheriff's office, things like that. They're a partner with this?
Absolutely. The Farmington Police Department, Rachel Graff, they've been fabulous. Sheriff's Department has been great. David Smith, you probably know, excellent mental health deputy. Very, very happy to work with them. They've been tremendous supports to us through the whole process.
Very good. And certainly Aztec Bloomfield, too. I don't want to leave them out.
Absolutely. Yes. Sorry.
Yeah.
Yes.
No,
absolutely.
that was me. So that's important, too. And I think that talks a little bit about the changes in law enforcement over the past few years. I think I can remember times when, the police would come to a call, and if somebody was disruptive or whatever, it was, you're being disorderly in public and off to jail you would go or whatever. And now I think there's been a bit more training on the law enforcement side to identify some of these issues that folks may be having, and maybe it is a mental health concern, and be able to maybe have more of a compassionate response and call in a professional than just the law enforcement side of things. Is that how we see it these days?
Absolutely. Our law enforcement is extremely well trained. In fact, even with working, and this isn't clinic, it's TOJA, still PMS.
Yeah.
Even with working with the Sobering Center, we're one of the few in the country that has a good working relationship with law enforcement. I mean, that's huge. They're really supportive on every level and receive quite a bit of behavioral health training.
Yeah. So that's great. And then they avail themselves of these services that we're talking about.
Absolutely. Yeah,
absolutely. That's really important. Thank you for that. And Andrew, I guess, again, this is really important too. This is something I know mental health, behavioral health are services that the health center offers too for folks who walk in during regular business hours, as it were. That's another service that's provided at the Farmington Community Health Center.
Yes, it is. And what I think is really that we capture with this and that people forget is that the services that we're offering, especially like the mobile crisis, we meet people in the community where they're at, and it prevents either a jail visit or a hospital visit. So it's less disruptive to, and there's lots of ways to think of this. You can think of it as patient-centered, which we like to try to do.
Right.
So it's less disruptive to the patient, to the family, and to society as a whole. There's also an economic component to it. If you can prevent someone going to jail, that saves money,
right,
for the community. But with what we're doing with the CCBHC is really kind of amazing, and it's the impact to the community long term really has a potential to be felt on all levels.
Sure.
Not just economic ones, but also in how we treat and assist people in crisis.
Right. And getting them the help immediately or quickly, 24 hours a day, which again is a major thing, because I think a lot of folks may be thinking about, well, if a family member of mine is having a crisis, I could try to get him in to see somebody, but that may be tomorrow morning or even next week, and there's a waiting period or what have you. This really turns that on its head a little bit about how to be able to get folks some assistance right away.
Yes, that's correct, and it's really needed. If anyone has experience trying to get in, sometimes it's a 2 to 3 week wait.
Right.
2 to 3 weeks. You either have it figured out or you don't need help anymore.
Right. Or it's gotten worse.
Because it's escalated.
Yeah.
Correct. So just the CCBHC has really allowed us to kind of step up our game and try to decrease that time, that turnover to get into services. Right now, I think the average time is 10 days, 11 days. Mm-hmm. It varies from week to week, but we're sitting right at 10 days to get into just our normal way of coming in the door. That used to be 30 days.
Wow. Right.
And those are business days, not calendar days.
Right. And so that's shortening as well.
That right there, that growth and that improvement is amazing.
Right. Very good. Well, that's another great thing, again, that's being offered here. I imagine there are other communities in our state, in our region, that looks at you and PMS and what we the community is doing when it comes to these types of services, and kind of is maybe asking you how did you do that, or how did you get everyone to agree to do that, because it certainly maybe isn't cheap, but as you mentioned, it's cheaper than a hospital stay or a jail stay or something like that. And so I imagine you're in high demand of sharing a little bit about what your expertise with how you've got this going with other communities. Is that what you're seeing?
Yeah. Specifically with PMS, we have two other programs that are opening up CCBHC
in other parts of the state.
In other parts of the state, Santa Fe and
Rio Arriba
County.
Nice.
So we are seeing the benefit, and then the other thing that's nice is we go out to other communities to see how they've done it, so that we can get our process improved. I know recently Kristine went down to
Doña
Ana and Bernalillo, right?
And Berlin, yes.
So
Right.
to look at something that's going the next phase of this, which is the CTC, we maybe
That'll be a future show.
that will be a show for another time.
Sounds good.
But it's part of that CCBHC model, and just really making sure that we're offering comprehensive behavioral health services throughout the community.
Right. Very good. But again, it's great that Farmington is kind of leading the way a little bit, at least with PMS locations and across the state, which for folks who don't know, Presbyterian Medical Services has services throughout New Mexico. And so it's always great to be able to talk a little bit about some of the things that are done here in Farmington and then elsewhere, as you mentioned, in both Santa Fe and Rio Arriba County. And when we talk about mental health and behavioral health, Kristine, I know this is something that is near and dear to your heart. You've worked with it for a long time and continue to provide great services and great support for residents in our area, and learning a little bit about how it's done in other places. Is that helpful then for you when you come back and bring it to Andrew or others and work with it at TOTA as well?
Oh, absolutely. There's always a lot to learn from how different communities do different things. One of the things that's just exceptional about San Juan County is we work really well together. There's a lot of communication between nonprofits and government agencies, the city and the county, the hospital, very supportive of community events, community services. So that's really enabled PMS to be part of an excellent continuum of care.
And that's really significant, I think. I hear that from a lot of my guests who come in and say, this is one of the areas in the state where we work really well together. Not sure why that is or how that came to be, but we're not complaining at all, because it provides for things like we're talking about this morning. And when you have law enforcement able to respond to a call and then send someone to you or call you in and bring out those professionals to be able to help this individual or whatever, and it avoids an emergency room visit or a night in jail or whatever the case may be, all these things do on the bottom line make an impact. And so that's something that I think other communities look at with envy to see how are they doing that in Farmington and San Juan County, and how is the hospital a partner with these organizations, and it works. And I think you've been able to prove that the bottom line shows that it works for a good reason, and folks really understand why they're joining something like this. That was a long question. I don't even know if it was a question, but it was a long statement. But it seems like that's what we see around the state. And so with that going forward, this is something that is continuing. Again, Andrew, you're talking about maybe recruiting some more primary care folks and other physicians to the health center. That is ongoing, I think, too. We see that all across the state and across the country, that need for more healthcare professionals in a community.
And we're always looking at, who can we bring in, but recruiting particularly, and we're working with, so PMS, the Farmington Community Health Center works with other community agencies, so we're watching what the hospital's doing, and the hospital's kind of saying, okay, they're being very innovative actually right now, and trying to figure out how do we recruit providers to this area, not just for them but for the community.
Right.
And so working with them and making sure that we're supporting their role, and that is good. Right now New Mexico has a hard time recruiting people. If you watch the legislature, it has to do with malpractice.
Right.
So hopefully we'll get some of that shored up and be able to have an easier time of recruiting some providers here.
Exactly. You mentioned the hospital. We've talked with them before about their residency program. I think that's exciting.
That's what I was referring to.
And that is kind of what we're talking about a little bit, about trying to maybe grow our own and have some folks who work here and get trained here and maybe want to stick around after a while, which would be great. So that's wonderful. Just a couple of minutes remaining this morning, both of you. And so before we go, any other thoughts that you want to share about other things going on at PMS or at the health center?
No, just for people to understand that we're here for you guys, for the community, and we really want you to have a good experience. And that's one of the things I would say is that we try to get and hear what your experiences are. I have a team that listens to that. So when you do your Qualtrics survey, we read all of those, not just the good ones or the bad ones. We read all of them. We provide that feedback to our providers anonymously. I'm not going to say Scott said this about you, Dr. Chin.
Right.
But we do pass on the good, the bad, and the ugly, and we get better because of the feedback that we receive from our patients. So I appreciate when everyone does that.
Very true. And I can state too that anonymously the board gets a little bit of that as well. And so we're aware of some of those results and how you're doing. And that's always good to see, because usually it's a lot of compliments, not so many grievances. So we appreciate that, and that's important. But it's a nice bit of feedback from the patients that are coming in to get that service. And so that's a really important thing. Before we go I want to mention the location in case folks aren't aware where the Farmington Community Health Center is. I think that's an important thing to note as well. The address is Broadway. You can kind of get to it from Broadway, but you also can get to it from Murray Drive, right?
From Murray, or it's where Broadway and Main come together. It's behind Three Rivers Estate,
right,
or the Senior Living Center.
Right.
You can access this from Murray or Broadway. Our official address is 1001 Broadway.
West Broadway, yeah, exactly. But you can still find it, so that's great. And
Yes.
And again, it is part of the PMS campus there, and so just nearby is the Navigation Center and the Community Compass, which I think is another great resource that PMS offers with the county. Again, another partnership that we're talking about, and just put a plug in for that. I know that's maybe not your 100% what you do, but you know a little bit about it. I know that.
Right. So we do work with very closely with the Navigation Center. They are housed inside the Behavioral Health Building there with us. We do warm handoffs with them. So if someone comes in and says, "Hey, I need help with this," and it would be better at the Navigation Center, we'll make sure that we walk them over to the Navigation Center. Same thing with Navigation Center. If they're have someone in there and they're like, "Hey, we really need to get this person in services. Do you have anything today?" Then we'll look at that. And of course, everyone always has a choice. They don't have to come to us. If the Navigation Center will help connect you with anywhere in the community. It's not exclusive to PMS. But yeah, there's a lot of resources. And then the Community Compass also has items for clothing, food, and Navigation Center also contributes with that as well.
Which is great, which is right there in that location as well.
It's all right there in the Behavioral Health Building. One place you can get everything you need.
Perfect. A one-stop shop, as it were.
One-stop shop.
There you go. Well, great. Well, thank you for coming in. Kristine, thank you for coming in as well. Thank you both. Always appreciate talking about PMS and sharing a little bit about what you all do in the community. So thank you both very much.
Thank you.
Thank you.
You're welcome. My guest this morning from Presbyterian Medical Services with me here on KSJE.
Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.